Welcome to the Explainer. So today we're doing something a little bit different. We took this incredibly dense review of 792 original studies on vascular closure devices, and we distilled the whole shebang into a rapid-fire 60-second burst of just the 3 absolutely most intriguing facts. Let's get moving.
Okay, let's dive right into this. After a major transcatheter heart procedure, medical teams face a pretty high-stakes problem. Like, how do you safely and reliably close a massive hole in a major artery in just minutes? It is literally a life or death scenario.
And that intense reality brings us directly to our rapid-fire list. Fact 1. Anatomy beats the device.
Now, you might think the gadget itself, whether that's metallic clips or some kind of high-tech suture, just guarantees a safe closure, right? Well, actually, device safety is kind of just an illusion if you ignore the patient's specific anatomy. Adverse events cluster really heavily around unfavorable environments. We're talking things like deep punctures, super narrow arteries, or heavy calcium buildup. Basically, if the anatomy's bad, relying solely on the device, that's just a recipe for complications. But here's the twist in fact 2, the ultrasound magic trick. 0%. Researchers actually found that using real-time ultrasound guidance to place the device, instead of just kind of flying blind, changes the game entirely. Get this. In one major study of heart valve replacements, using ultrasound dropped severe complications from 1.8% down to literally 0. Guided imaging really is the ultimate magic trick for patient safety.
Which brings us soaring right into fact 3, the sci-fi future. We are moving so rapidly beyond the days of just manual pressure and traditional sutures. These new experimental technologies are achieving incredibly rapid sealing. We're talking shape memory plugs that literally conform to the vessel wall, bioabsorbable devices that just sort of melt away as the body heals, and even water-activated adhesive patches that seal right on contact. It's totally wild.
Crucially, vascular closure devices function primarily as workflow-enabling technologies. What that really means for us is they accelerate healing, they get patients walking faster, and they speed up hospital discharges. But, seeing how fast and targeted this sci-fi tech is actually becoming, it really leaves us with one big question. Is the era of manual compression finally obsolete? Definitely something to think about. See you next time on The Explainer.